Good morning, ladies and gentlemen. As you know, the COVID-19 pandemic has seen the world divided over the appropriate approach to rationing healthcare and who perishes when resources are scarce. Although the individual right to health is a nice sentiment, it cannot be preserved in times of crisis, as the survival of the greatest number of people becomes a priority. The current ethical stance of Australian medical care, although adopted limitedly, is from an egalitarian conception of distributive justice enshrined in the right to health. This ideal is in direct conflict with the essence of rationing to save the greatest number of lives, requiring the prioritisation of age. Despite the essence of public and private healthcare pitting the rich against the poor, the government has moved towards a utilitarian approach by way of integration, prioritising community over individuals. An egalitarian conception of distributive justice is evident in the right to health, entrenched in the International Covenant on Economic, Social and Cultural Rights, to which Australia is a signatory. Article 12, subsection 1 states that everyone has an equal right to enjoy the highest attainable standard of health. Similarly, distributive justice asserts that all people should be treated fairly and equitably when receiving health care. Moral and political philosopher John Rawls stated that distributive justice promotes the equal respect of all patients, meaning that those with the same need be awarded the same rights to services, and those in greater need be provided more significant benefit. However, criticisms of distributive justice in the sphere of bioethics argue that the theory fails to acknowledge other variables affecting equality of healthcare, including emergency conditions and economic status of individuals. Although Australia has not adopted the right to health as domestic law, Queensland has acknowledged in its Human Rights Act 2019 that a person has a right to access health without discrimination and must not be refused treatment that is necessary to prevent death or serious impairment. A utilitarian prioritisation approach to rationing conflicts with the egalitarian distributive justice approach evident in Australia's legal attitude to healthcare, but must be superseded to ensure the greatest survival. A utilitarian approach to the distribution of resources, in which prioritisation by age may be a necessary consideration, is desirable for ensuring the survival of the greatest number of people. Utilitarianism seeks to maximise the distribution of resources for the benefit of society as a whole. However, saving the greatest number of people in rationing situation involves prioritising those with the highest probability of surviving who require the least amount of resources. This concept focuses on those with a higher probability of survival who are expected to recover quickly, freeing up resources for those in greater need. Statistics reveal that age is the strongest predictor of death from COVID, with the death of 904 Australians between the age of 50 and 90, compared to only 5 deaths from those under the age of 50. It is argued that, like Italy, the prioritisation of resources in Australia should be guided by the life cycle principle. The goal of this principle is to give individuals the opportunity to live a normal lifespan. However, the main arguments against the utilitarian prioritisation approach is that what is considered the concept of the greatest benefit is subjective. Furthermore, it ignores justice and equal individual right to healthcare, often resulting in unpalatable consequences to achieve the survival of the greatest number. However, the bioethical principle of beneficence arguably supports this shifting of resources from the elderly to the young. American philosopher Daniel Callahan argues that using age for the purposes of prioritisation is not unfair, as it is for the purposes of achieving equity between generations with regards to lifespan. A utilitarian approach with a focus on allocation to the young is most appropriate, as a survival requirement of rationing is to save the greatest number of people. The reality of rationing in COVID-19 pandemic has caused the Australian government to integrate the private and public health sectors, prioritising community health. Generally, the public system is funded by the government for the provision of care on the basis of need, whereas private health distributes resources which are only limited by people's ability to pay. However, in March 2020, the Minister for Health entered into a partnership with the private health sector to provide additional beds and medical staff during the pandemic. The integration of the two sectors reveals that due to unprecedented conditions of the pandemic in Australia, the government are willing to adopt a utilitarian approach to healthcare over the rights of individuals. This form of distribution violates the autonomous free exercise of individual options, especially to those who pay for priority healthcare. Although the public and private structure, where separate, can arguably be criticised as not providing equal access to the highest attainable standard of healthcare, as prescribed by the right to health, the conditions of the pandemic reveal how much relief the private system can provide in times of crisis. Therefore, it is clear that the government supports a utilitarian approach to rationing healthcare over the rights of individuals. As seen from these arguments I have presented today, it is evident that although the individual right to health is a nice sentiment, it cannot be preserved in times of crisis, as the survival of the greatest number of people becomes a priority. Thank you.